give presentations, the tone is of the voice of the presenter is low and monotone, and I'm the one that brings the energy. Now I have to live up to Vita here. I can't even match that right now. Should have had my double espresso this morning. Good morning, everyone. Good morning. How's everybody doing? Yeah. Doing good? Well, very nice to be here. So many things before I begin. Number one, I want to give Kim a sign of gratitude for having me here, and Dr. Bergodia for connecting us. This is amazing. This is what I love to do. I think there's a lot of disinformation and misinformation on the internet on natural approaches to anything, particularly cancer. And I like to always bring an evidence-based approach along my clinical experience of over 20 years as a naturopathic doctor into this space. So thank you so much. You know, this is so touching in many ways, right? You know, many, unfortunately, like Kim, parents lose their kids. You know, in New York, as you can imagine, everybody's stressed. It's not a matter of your type A personality, it's a matter of your type A1 or type A2 personality. That's kind of where we start the conversation. And when everybody, you know, part of the discussion is, you know, what's your stress level? And, you know, scale of 1 to 10, and every New Yorker, of course, is above 5 for sure, many approaching a 10. And the conversation always leads into the, you know, do you have children? Yes, I do. Are they healthy? Yes, they are. What is it to worry about? Right? So you always have to take it back to basics. And, you know, so it was very touching to hear Kim's story for the first time, Jordan's story for the first time, and to learn, of course, that his, you know, birthday celebration is coming up soon. And then, of course, it was shocking to know that his birthday is exactly the same day as mine. And so that was touching, right? So there's a lot of emotion that comes along with this, of course. And so moving forward, those that are still here, of course, you know, the term survivor always hits me the wrong way as it relates to cancer, because I prefer thriver, right? So how can this diagnosis give me an opportunity to live even better than I did before this diagnosis? Of course, sometimes TC happens in young children. But how can I be a thriver, not a survivor, right? And that's kind of because words matter, survivor. I just made it. I'm hanging in there, sort of. No, you're a thriver. You live better as a result of this diagnosis. And you make the best of your time while you're still here, right? And so that's kind of the terminology that certainly I use frequently. So thanks again. You know, I'm a millennial, so I have to take a picture so that my family knows that I'm not in a baseball game or a soccer game today. So I'm actually working, you know. So everybody say, I won't be able to get everyone. All right, guys, I'm working. Many of you looked at, you know, when I said I'm a millennial, you guys said, that's a millennial, he looks old. I'm not a millennial. Generation right before, right? Let's see, so this is I can do that, great. All right, testicular cancer, let's get right to it. There's a lot to say, and I have very little time to do so. These presentations, I usually give week or month-long lectures on this, all right? So here's how we're gonna roll today. Okay, dance with me. I'm also part Cuban, by the way, so dance with me. Everything is dancing in Cuban. So you can kind of roll with me here. You may step on my toes, or I may step on yours as we go, but I always bring it back. We're always gonna get back on pace. All right, so we're gonna dance with me here. There's gonna be, you know, I don't always have everything I say on a slide, because if that's the case, I could just give you the slide, you can read it and just go home. Right? So there's always other information that I think is really important for you, just from my clinical experience and things that you should know as we go along. And it's not that many slides here. We're going to make this engaging and fun, despite the topic that sometimes is not as fun, right? So let's go with it. So thanks again for having me. Here we go. So genetics. So here's the deal. You know, testicular cancer is really a double whammy. The double whammy is genetics and environment. That's the double whammy, as best as I can tell in my research so far, right? Genetics, so you have a genetic predisposition to testicular cancer, plus your environmental factors are not clean, and we're going to talk more about environmental factors than many other things, because I think that is probably the main component and contributor to testicular cancer, okay? So that's double whammy, genetic predispositions and environmental factors. So these are just some, there are many other genetic polymorphisms and situations that can increase the risk of testicular cancer. So you want to, it depends on what stage we're talking about, right? So our conversation today, we're going to talk about prenatal. So what can the mom do as she is pregnant with her son? Postnatal. So, your kid is born, what next? And then after diagnosis, what do you do post-diagnosis? Let me say this, by the way, as well. Chemotherapy, those kind of drugs, when you look on the internet, of course, and look at influencers and so forth, it's referred to as a poison, and it is. But one of the few cancers that we can say that such approach helps people is with testicular cancer. So the notion of finding natural approaches only when you're diagnosed with testicular cancer is one that I don't subscribe to, right? The surgical procedures are great. You have great surgeons certainly around the country, certainly here in Indiana, and the chemotherapy actually does work really well in testicular cancer. So there is no, in my opinion, alternative approach to testicular cancer. There's either a medical approach or probably even better, an integrative approach where you can use both. So many genetic predispositions to cancer. This is a short list. So let's talk about the environmental component of things. So there's a lot of things that we're exposed to in our environment that increases our risk of testicular cancer, both prenatally and postnatal. Phthalates are substances in the environment that you find in air fresheners, including the taxi driver who drove me here this morning. Food containers, cans. So when you're eating your green beans from a can, that inner lining is an endocrine disruptor. Contains phthalates. Electronics, sometimes even dollar bills, just currency, contain different chemicals that we're exposed to. Once again, I'm hoping that once I end this conversation with you, you leave here with more clarity and not more confused and not more paranoid. Because it's going to seem like everything causes testicular cancer once we're done. Okay, so bear with me here. Let's keep dancing. Then we have the parabens, which deodorants have contain. A lot of the lotions that people wear, right? Everything you put on your skin is absorbed, or at least if it's lipid soluble. So, if it's water soluble, is not so much, but if it's lipid soluble, fatty substances, there is absorbed by your skin. So your skin is an absorption organ. So just keep that in mind. Everything you put on your skin is absorbed in your body. Perfumes, colognes, and so forth. All these things, are a factor. Now, I'm not suggesting that you don't, God forbid, don't wear deodorant or perfume every now and then. My son has just turned 11 years old, and I just remember that first stink. It was about a year ago. Man, that was horrible. Like, what is this? It's like, that's your son. He just came from playing baseball. It's like, he needs to, get into the shower, and we need to clean him up. And then when they wear those sports shirts, sports shirts is even more pronounced, right? It's like, what's going on here? Anyway, but we don't want that. So hopefully I will be able to give you some alternatives that you should consider. In any event, these are endocrine disruptors, what does that mean? There are hormonal elements to it. These are estrogenic mimicking substances that mimic estrogen molecules. Exactly how it works to cause problems, I'm not exactly sure. It was thought that these estrogenic chemicals attach to receptors, just like estrogen does in the body, and they cause problems. I'm not exactly sure that that's the mechanism. It may be, I'm not sure. But what we do know, there's correlation and association with these endocrine disruptors and testicular cancer, both prenatally, thank you, and postnatally. Here are more PCBs. Again, you find these in paints, right? So when you clean your house, you have when you paint your new home, you have all sorts of chemicals in that paint, including PCB that you inhale, and it can be problematic. Now, there's great alternatives out there that we'll discuss. The oil, to change the oil in your, car mechanics, right, that work with engine oil all day. If you change your own oil in your car, right, those fumes are chemicals that you inhale, it gets in your system, and can potentially cause problems. Now, once again, just I'm at risk of being repetitive. If you have a genetic predisposition, then you want to be super careful with these. If you don't, you still should, but probably not as much. Because you're probably wondering, well, my uncle Max is a car mechanic, and he never developed, actually he's 72 years old and is kicking butt. Yeah, that's genetic elements to this whole thing. Pesticides. These are the sprays that are insecticides, pesticides, herbicides that spray your food. In most European countries, they do not accept many of these chemicals that are in our foods. And certainly, I'm not getting to. I love America. I know there's some military people out there. I am pro-USA. All right, so let's get that out of the way. But certainly, there's more we can do in terms of keeping our food system cleaner. These pesticides are endocrine disruptors and tend to cause multiple, or at least contribute to multiple cancers, certainly testicular cancers. But man, Dr. Gio, that organic food is expensive. Do I gotta get organic food? That's a great question or great point, because it is more expensive. So the way you go about it, so there's a couple of ways to look at this, actually, in terms of the expense of doing healthier things. Being healthier is initially expensive. I haven't found another way. So when you eat cleaner, it's more expensive. There's a reason why, the Big Macs and fries are, not as expensive. There's a reason for that. That's because the quality is very low, right? So the way I would frame it in your head is the following, as it relates to the expense of being healthier and doing healthier things. And this is the conversation I typically have with patients. You have a budget for your health, just like you have a budget for your mortgage and a budget for your car insurance and your car payments. You have a budget for it, and then you don't deviate from that budget. That's your health budget. I have one for me and my family. I have 3 kids. I'm not even going to tell you how much that is, but anyway, that's a different story. But you have a budget, so that now everything else works around that. I've had the luxury. Well, first of all, just a brief background. So they say, Gio, you don't really understand. No, I understand. I grew up in the South Bronx in New York on welfare, and somehow or another in that environment, all the kids had the new sneakers that cost $100 back in the day. I don't even know how that happened. But everybody had the new sneakers. So in this country, you can pretty much get what you really value. The question is, do you value it? Later on in life, I worked in restaurants. So bartender and waiter, and many of the ones that worked in the kitchen were immigrants, and you can argue that, man, they work 70, 80 hours a week, probably make $400 a week, $500 a week. That's not that much money. You can make that argument. Somehow or another, when they were drinking and driving and they got caught, all this money came out for lawyers and things like that, right? So what I would say is you want to create a budget, your health budget, and include that into your overall budget so that you can probably buy more organic foods. One last thing I'll say about organic foods and so forth. Not everything needs to be organic with the label. Typically, local farms are organic, but the USDA stamp of organic is kind of expensive, and a lot of farms are like, no, I'm not going to pay for that, and I don't blame them. So when you shop from a local farm, I'm here in Indiana, there's not that many local farms in New York City, so we go to farmers markets, and typically the food is about 50 to 100 miles away. That is organic-ish, or just organic. It's just that they can't put the label on that, okay? So either, and I prefer farmers or local farms because it's healthier. The question always comes up where, Dr. Gio, should I eat the organic apple from New Zealand or the one from the farmer's market that's 50 miles away? Great question. You always want to eat local first, closest to you first. Again, you talk to the farmers, it's organic or as organic as it needs to be. Always shop for your produce that's where the farm is closer to you first, and then organic. The apple that came from New Zealand is how much nutrition. That's another comment. I could really go, man. Well, why do we need dietary supplements? I want to get everything from food. I wish it was that easy. Sometimes if you eat that apple from New Zealand, it's 50% less nutrient dense than it is from the apple that's close to you. So there's that component of it. Bottom line takeaway: eat local first, and then eat organic with the stamp. Okay. And then there are, so these pesticides, herbicides, and insecticides are endocrine disruptors and can be contributory to testicular cancer. This is a busy slide, right? But it shows the evidence of prenatal exposure to different pesticides and then postnatal life. Here's the bottom line, very quickly. All these pesticides, PCBs, parabens, phthalates, it's both important prenatally as it is postnatally. Okay, so you want to pay attention to these. So one study says this, the other one, the bottom line is that's the takeaway. So what you want to do, or what I try to, I don't, very infrequently, to give you background, some context of my practice, I see men with male infertility. That's a portion of my practice. And then some men who have, male oncology situations like prostate cancer or testicular cancer. So I never get an opportunity to meet with pregnant women. But in my audience, I have an audience out there somewhere online, about maybe 10 people on Twitter and 20 on Facebook, that they listen to. I'm an influencer in my house. So all my kids, I'm influencing all my kids in my house. Anyway, I do talk about women getting tested for toxins, and if they're pregnant certainly with boys, maybe the gender doesn't matter, but that's been my focus on research with boys, then they should be very careful with these environmental chemicals and reduce the exposure of them. Ultimately, the poison is in the dose, right? So how much exposure? You're going to be exposed. Everyone is. You cannot, run away from that fact. But the question is, how can we significantly reduce the exposure so that you can make a more mindful decision on the things you put on your skin, the sprays that you use to clean your house, the foods that you eat, whether they're organic or not, right? So women should test for toxins, and they should do some of these environmental elements to reducing the risk. After the child is born, at some point there should be some genetic testing done to see where they are in their predisposition to testicular cancer. the kid that has a predisposition to testicular cancer, the parents should try as much as possible to, whatever they have control in, which is in their house, sometimes it gets very difficult when kids go to school and things like that, to limit the environmental toxic load that the kid is exposed to, right? And then as you grow older, certainly after diagnosis of testicular cancer is a very similar approach. Reduce the environmental toxic load. So, I'm taking a shower this morning, in my hotel, right? Feeling good, had good sleep. I had my 10-year-old coming to my bed in the middle of the night from having a nightmare, kicking me all over the place. Sleeping good. Go take a shower, look at the body lotion, look at, oh man, this is nice. Oh, wait a minute. Phthalate free and PBA free. Oh, thank you, Ken. You chose the right hotel for us. Right? So I was very nice to see that they have, I think this information is no longer new, and many companies and people in general are up to speed with, changing things and reducing the toxic load from things that we put on our skin. Shampoo is paraben free. Of course, it's something that I don't have to deal with, right? It's been a while for me, so I add shampoo or conditioner. But it's interesting because I miss my hair. It's been over 25 years. So then my son, I give him a hard time with getting haircuts because it's like I'm living life vicariously through him with his hair. Hopefully not in any other way. So I have a barber experience through my son. All right, we gotta go. I'm excited. He's not. All right, you gotta get a haircut. Get a barber. Dad, I just had a haircut a week ago. So what? You have too much now. We have an event. What event? I don't know. Go back to school. I don't know. So I have the experiences that I miss with that. And I get him the shampoo and the conditioner, right? And of course, paraben free. I've tested my son for all these things, and he doesn't have these genetic predispositions, so I kind of limit, the amount of reduction of these things that, you have to choose your battles, right? But certainly if there's a family history, genetic predisposition, you want to pay attention to these things, and these things are available. All right, so how to test for these things? So the reality is that many of the commercial labs do not test for these, so you want to see either a functional medicine doctor or a naturopathic doctor. This is sort of environmental factors to disease is what we know. That is what we learn, and to all diseases, and that's part of the training. I just had the good fortune after my naturopathic and functional medicine training to specialize in urology at medical institutions and just kind of, go narrow and deep, right? But so these tests are available. Likely the medical doctor will not do these tests or even know that these tests exist. So there are companies out there, Vibrant Labs is one of them, and I just don't want to, there's so many, that do Genova, Genova, that do these kinds of tests. So you can test and see what the predisposition is. Number 2, I like Fellow being here. They're a great company. I use them. I think when, there's only so much testing you can do with a patient. So with many of my patients who don't have male infertility issues and are not thinking of having children, I do semen analysis on them because many reasons. Healthy semen health, healthy semen levels, and healthy semen as a whole is associated with living longer and better. Just mortality studies have shown that. So I like to see, is one of the biomarkers I use to look at longevity factors. Number 2, men who chronically have poor semen health have a higher risk of testicular cancer, right? So it's important I think it's a great biomarker to look at. So semen analysis is one thing we do. For women, again, I don't see many women. There is some studies, correlation, probably not causation, but there are some studies that indicate the following. Women who have more nausea and vomiting in their first trimester typically have more of a toxic load than women who don't. Okay? So perhaps that could be a sign, perhaps, to look at, test these women to see where the toxic load is. So that's actually something very interesting. And number three, you want to, toxins, number three, you want to, once there's a diagnosis, you want to be able to look at these genetic predispositions in the child and perhaps even in the mom. Okay? Other tests, so you want to do a toxin test, again, ifm.org, I believe, is the organization of the website that is the functional medicine. Here's the thing, you're looking on the internet and there's a lot of information. I love the internet, but we must be very careful with it for many reasons. One is that you could get misinformation, and sometimes it's not about what's valid, it's about who can present the information in a more appealing way. And that's where you're going to go, right? So the person who can present that information in a more exciting way and so forth, that's kind of where you go, and you have to be careful with that. I say that because there's a lot of natural doctors out there that are not trained or certified or licensed. So functional medicine doctors, ifm.org, there's a where to find a doctor there, and naturopathic.org, again, you can place your zip code and you can find a legitimate naturopathic doctor, okay, that can look at these things. You also want to look at metals. So metals are associated with all sorts of fertility issues in men, cadmium, mercury, so you have to make those adjustments as well, and those could be tested for as well. That's that. Oh, genetic testing, of course, I mean, look, there's many companies out there. I think that even the 23andMe works very well, though it's not a clinical test. And then you have to learn how to interpret that information, and there's softwares that can help you with that. But there's many companies out there. There's DNA Life, I use Invitae, which is a clinical test, and commercial test as well. There's many ways to test for genetic predispositions, but those are the main three that I'm familiar with. Ancestry has one as well. So postnatal, all right, so you have it, what happens now? So this is a recent study that was published that shows the leading cause besides TC were lung, bronchus cancer, colon, rectal cancer, heart disease, accidents, suicide, and self-inflicted injury in TC patients, right? So once you've had TC, of course, it's a life-threatening condition, but oftentimes it may not be. So you'll have to look at the bigger picture. The bigger picture is that you can still die from a heart attack or something else, so how do we reduce that risk? Obviously that's a story, very long story, but here's how I would break it down. Let's start with diet. There's diet wars out there. Who's confused about dieting? Raise your hands. Raise your hands. The rest of you are not confused at all. You know what you eat that one. Yeah, it's like, of course you're confused about dieting. You know, you could go paleo one day or plant-based the next. These are contradicting diets, and they all sound great. Now you have the carnivore diet, of course, which is like, you don't even eat vegetables. You only eat animal products all day. Ketogenic diet. You know, I remember when I first started this whole path, because this pre-internet, so it's like 26 years ago. So the food combining diet was in by the diamonds, and it was like you don't mix carbs with protein in the same meal. So I was like all in on that, and I've done every diet between Atkins and Zone. experimentally and so forth. So pretty familiar with all of them. What I would say is this: you should be confused. Okay? Now, from a typically the better eating approach reduces the risk of many things. You know, death from cancer of any kind, cardiovascular disease, and so forth. All right, so Gio, what's that diet? What's that diet? So here's what, I feel like I'm talking to a patient. Here's where we start. Number one, before I make any suggestions, eat like this, eat like that, I say eat 50% less. Start there. But what should I eat? I don't care. Eat 50% less. Number one. Number two, eat until you're 80% full, not 100% full. But what should I, we're not talking about that. Because that is part, I was involved in a confusion early on in my career. Eat like this, not like that. They came back, they were in bad shape and not following anything because I confused them with too many rules. In my experience, the biggest issue is not meat consumption or this consumption or that consumption, is the overload of too many calories and too much eating of all these things. Eat 50% less, eat until you're 80% full. Then we can get into some nitty-gritty stuff, right? The general rule of what to eat, again, you gotta keep it simple because you're confused for a reason. The general rule is this: eat single ingredient foods as often as possible. That's it. The ingredient list should not be too long. Like, what's the ingredient list for broccoli? It's broccoli. Okay? And that's it. If you keep it simple that way, okay, organic, not organic, you want the cleanest food possible that you have access to. So single ingredient, cleanest food possible. As it relates to drinks, you always want the fruit and not the juice. You want the fruit way more than the juice. So apple juice and an apple are two completely different things. They're not the same. Okay? They're not the same. So you eat the fruit, not the juice. Secondly, what else to drink? You know, coffee seems to be fine in almost every study I've read. Of course, there's some people have CYP mutation. So, for example, I don't, or I do. I think I do, which is the reason why I can have an espresso at 9 p.m. and go to sleep at 11. You know, Cuban gene. Many of you can't. So you have to figure your uniqueness with things like coffee. In general, on average, coffee is a fine thing to drink. Just coffee, not the extra junk that you put in the coffee. Just the coffee. Nice and bitter, of course. In general. Alcohol consumption is actually very interesting because many of us do it, and so it's a matter of how do we do it. And I've done a deep dive in alcohol on my podcast, the Dr. Gio podcast, and about as it relates to cancer and things like that. So alcohol, I think the bottom line is this, another takeaway. The bottom line with alcohol is the following. The bottom line with alcohol is that there is no amount of alcohol that's healthy for you. Some of you are looking at me like a Dr. Obvious over here. No, I think that there's been a lot of information of how some alcohol is actually beneficial for you out there, particularly in the US when they recommended the guidelines, which is going to change in 2025, indicates that 2 drinks per day for men are fine, 1 drink per woman a day is fine, when no amount of alcohol is fine. And those guidelines are going to change to that in 2025. So what do we do with that information? Because you're going to drink anyway. So a general rule of thumb is the following as it relates to alcohol. Yes, it increases the risk of all sorts of things and recurrences with many cancers, and certainly many male cancers. I don't want to oversimplify because it's like, how can one food or one drink increase the risk? So it's a little bit more nuanced than that, but in general, these are the guidelines. So what you do with alcohol consumption is the following. You have, if you are going to participate in alcoholic intake, you have no more than 2 drinks a week. 2 beers a week. Some of you, how many of you are going to step out and now go, okay, this guy's a quack. I don't like what I'm hearing. Those are the guidelines. 2 drinks a week or 2 beers a week, or 4 glasses of red wine a week. Try not to have it too close to bedtime, because alcohol consumption will, thanks so much, alcohol consumption will disrupt sleep. And I think I think alcohol itself can be a problem when it's overly consumed, but I think the bigger problem with alcohol is the disruption of sleep. I think it's the bigger problem, would be my guess, right? So you want to have it earlier as possible, and then if you break the rules here and there, just break the rules intelligently. For example, if you have it, a couple of hours before bedtime, because it's like, I don't know, New Year's Eve or something, that's fine, you should be fine. If you do a lot of the other things that are good, eat well and so forth, you should be fine. If you exercise, you should be fine. So that's sort of how you want to think of it. Also, in my practice, once I started asking better questions, so, as a clinician, you're only going to get the answers based on the good questions you ask. If you don't ask good questions, you're not going to get good answers. So I started asking a lot of questions about alcohol consumption, and in some cases, there might be a problem. And one of the things I noticed is that those that one of the guidelines, and this is my own, I made this up, so that means that I could be wrong, right? Is that never more than 2 drinks or 2 beers in one night or one day. If you need a third, if you're going for a third, you might have a problem. You're numbing something, that you might try to run away from something. There's no need. When was the last time you gone for a third plate of food anywhere? Right? So a third drink, I always find that third drink, 4th, 5th, something else is going on. Right? So you have to kind of have an honest conversation with yourself about that. That said, I like to be holistic, but realistic. One of the biggest problems men have is isolation. That's one of the biggest problems that's negatively contributing to male health, is isolation, loneliness. So, holistic but realistic, if one of the ways you get together with other men and engage and have fun is maybe alcohol is involved, then you go for it. I do believe that the engagement with others offsets whatever ill effect from that alcohol, that consumption scenario. Okay? Hey, Gio, I got this new bourbon from blah, blah, blah. Yeah, I'm going. I want to try the new bourbon. More importantly, I want to try the new bourbon, but I want to talk to you and engage with you. But the rule of 2 still applies. If you need more than 2, or your friend, come on, Gio the third, come on. There's no need for more than 2 ever. Does that help? Right? So that's alcohol. And then it's like water, clean water, and things like that. People are into juicing and wheatgrass and things like that. You go to the bar, you think you're getting a top shot of tequila, you're getting a shot of wheatgrass. Whether wheatgrass or juicing seems to be fine. I know that there's some cancer therapies out there, natural therapy, that do a lot of juicing. Actually, one of them is the Gerson therapy that you may have heard of. They do it in Tijuana, and it's been around for a long time. What I have to say about that is that, the Gerson therapy, to summarize, and is a Gerson therapy for cancer, so it's very specific to cancer. So a lot of my patients come and say, look, I'm doing so well from the Gerson therapy. All right, anecdotally. The bottom line is that, the protocols I think that I prescribe, I hope, and that you should consider is something that's sustainable, that you can actually do long term. So the Gerson therapy requires fresh squeezed juices of all these vegetables 7 times a day. So it's not like you can store it, but you need to squeeze it fresh squeezed, So that's a lot of time. You're spending most of your time in the kitchen and the bathroom because then you got to pee a lot from all the juicing. So that's that. And then Gerson therapy involves coffee enemas, so 3-4 times a day. So I just never found it to be sustainable. Nonetheless, whether or not it works is irrelevant, right? So that said, and in the Gerson therapy, I find that they juice a lot of carrots. Now, again, apple juice and apples are not the same. Carrot juice is not exactly the same. The glucose load in carrot juice is significant because there's glucose in carrots. And then you'll look orange all day. And that's not cute, right? So the protocol should be, now it's hard still, because if you're going from 0 and you're trying to do better, it's difficult, it could be challenging. So but it should still be sustainable. And then once you get some wins, if you're overweight, you lose some weight. That's an easy one. You're like, oh, you feel better. Oh, this is great. And then hopefully your test results are good and so forth. Then you start, you get into it. It's a lifestyle. It's not a temporary thing. All right. So here's what I can offer you other than this presentation. You can stay in touch with me through these mediums. My email, I have, alternatives to things and more information to offer. So you can find all these things here, and then certainly within the next 6 months there's going to be even more information that we're going to post there. And I am happy to entertain questions, or we can leave the questions for later. It's up to you. Okay, you let me know. But thank you all for listening. I saw no one falling asleep through this conversation this morning. I'm very happy. A few nodding, but that's no sleeping, so I appreciate that. Thank you so much for listening, and I hope this was useful.